welcome. Really happy that you can join us. My name is Aileen Fink. I am a behavioral health administrator with the Department of Services for Children, Youth, and Their Families, often known as the Children's Department. And I'm really excited to be here with my co-presenters, Malia Boone, who is the program manager for the Youth Crisis Program operated by Delaware Guidance Services, and by Barbara Messick, who is the executive director of Champions for Children's Mental Health. And we're here to talk with you briefly about children's mental health and COVID-19. And I'm going to get us started just by talking a little bit about why we think this is important. So at the Children's Department, we're responsible for providing prevention, early intervention, and mental health and substance use treatment for children under age 18 and their families. And what we know is that children's mental health disorders are incredibly common. So about 1 in 5, or 20% of all children, will experience a mental health condition. We know that those conditions often start young. So about 50% of them actually start before the age of 14. And we also know, unfortunately, that many children, maybe 50% or more, may never receive the mental health interventions that can be very helpful to them. In terms of sort of the most common mental health issues for children, often if we look at diagnosis, we know that anxiety, depression, and attention deficit hyperactivity disorder are the most commonly diagnosed. But we want to talk a little bit today about the issue of trauma. And again, talking about COVID-19, because we know that many children are exposed to traumatic events. And we know that that exposure actually increases the risk for a variety of health problems, including different mental health problems. And certainly we understand trauma as an experience of high, overwhelming stress that can really impact children's healthy development. And so why mental health and children's mental health and COVID? Well, we are certainly all experiencing an unprecedented level of stress, and that is certainly true for our children. And in addition to this general stress, we also know that unfortunately some children are going to experience things like traumatic loss. We know that unfortunately COVID is taking the lives of people here in Delaware as around the country and the world. Experts are very concerned in terms of COVID. We know obviously that we're all sheltering in place, and experts are talking a lot about the concern about the increase in exposure to child abuse, as well as violence within one's home. And we know that those are traumatic experiences for children. Certainly we know that, this physical distancing, as some people prefer to call it instead of social distancing, that physical distancing in and of itself is stressful for children. They're not able to see their friends, they're not going to school as they usually do, and that's particularly concerning for children's mental health because many children in our state actually receive their mental health services in school. And for many of them, actually, school is the only place where they're able to access those services. So we know that both children are under increased stress, at the same time that they may have less access to the supports that can really help them from a mental health perspective. So what we know is that many children have mental health issues, that COVID can certainly increase the symptoms of different mental health issues or can bring on a new mental health problem. And all of this sounds a little bit discouraging, but I'm happy to tell you there's actually good news. And you're going to hear a lot more from Malia and from Barbara. But the fact is that there are a lot of things that we can do to support children, to help promote good mental health, to help them if they're experiencing signs and symptoms of mental health conditions. And I also just want to highlight, and I know Malia and Barb are going to talk about this, but I want to highlight the importance of understanding the support of the caregivers, of the adults in the lives of children, who are then supporting these children. Children live in the context of their family and community. And so if we want to help children have good mental health and we want to support them if they're experiencing difficulty, we also have to make sure that we're taking care of those adults. So that's just a little introduction, thinking about how common children's mental health problems are, why COVID in particular raises this as an important issue to discuss. And what I want to do is now pass the baton to Malia to talk a little bit more. We want to give you some useful information. Pass the baton to Malia around some things to look for and some things that caregivers can do. So Malia, take it away.
Thank you, Aileen. So, right now we have many youth in our state that are struggling with the impacts of their mental health during COVID-19 restrictions. And we want to provide you all with some information that can be helpful to determine, how do I know that my child is struggling? What are some of the specific signs that caregivers can watch for in children and youth that may be indicating that they need that additional support? So I'm going to start by going through some of the different things you may be seeing that indicate that there is a need for additional support. And then I'm going to switch to also some strategies that you can use to help support your kids. So first, the first sign might be increased isolation and loneliness. And that might sound funny because we are all doing the best we can to stay physically distant from each other. But, as that is happening, we're also feeling sometimes even more and more isolated. And children may be isolating themselves even more. So you might notice your child spending a lot of time alone in the room, not connecting with even friends over text or social media. You may also notice your child feeling more and more disconnected from their friends or other important people in their lives who they can't see every day. And this is an especially hard time for teens who already have, a natural drive to spend more time with their friends, and they aren't allowed to see them during this pandemic. So these increased isolations or feelings of loneliness could really be indications that your child is struggling, possibly even feeling depressed. Some other things you might see are sadness, anger, and frustration, these really big emotions that can overwhelm us. Your child may be crying and not know why. They could be really angry, and a lot of children are really angry right now about losses they're experiencing, social milestones like the prom, 8th grade dances, class trips, promotions, sports. So we have a lot of things that have changed, and kids can feel pretty angry and frustrated that they're not able to do these things. Some kids may even feel angry that their caregivers won't let them leave the house and hang out with a friend. So another one is excessive anxiety and fear. And Aileen talked about how, trauma and other mental health disorders can show up as anxiety and can show up as extreme stress. So in conjunction with what's happening during the COVID-19 restrictions, stress and anxiety are impacting a lot of people right now, kids and adults. And for children who don't feel like they have a way to control or really get a handle on what's happening, this can really intensify feelings of anxiety, and they could even feel panic. They could have excessive fears about their family getting sick or even not having what they need. So depression and anxiety are two of the most concerning mental health impacts of the COVID-19 pandemic. And we want to make sure that we're looking out for those signs of that intensity of feelings around sadness and anxiety. Finally, I want to talk about one more sign that you may notice with some of your kids. deterioration and behavior. When we're talking about deterioration and behavior, we're thinking these are children that are really struggling to manage all of these overwhelming feelings that I just spoke about. They might start having trouble managing their behavior because of how overwhelmed they feel with these feelings. So this could look like excessive agitation, like yelling at people in the house. It could be like tantrums, physical aggression, where they're becoming aggressive with other people in the house or objects in the house, or even running away. There may even be times that children are harming themselves or thinking about suicide. And if behaviors are escalating to the point that the child and others around them might be at risk of harm, it's really important that we're reaching out to professionals who can help. The youth crisis services are available 24/7 in Delaware to assist children and their families, as well as other mental health supports that we're going to be discussing later in our discussion, in our talk. And if you need help keeping your family safe during a mental health emergency, please call the crisis hotline at 1-800-969-4357. So all of these signs can be indicators that your children are really struggling, but switching gears a little, there are definitely things that caregivers can do to protect against any potential impacts and help build resiliency to cope during this time. So here's just a couple. One, talking with your kids about COVID-19, using age-appropriate language depending on how old and what the developmental level of your child is. You want to think about just providing facts based in science and thinking about how do we explain to a child what quarantine is or why people are physically or they hear socially distancing. Kids will find out as much as they can from unreliable resources if they have to. And even when they don't have any information, their imaginations can make things so much worse. So having these conversations with your kids can be reassuring. Also, trying to create regular routines, but also with like an added layer of flexibility is really important. Right now, I know a lot of kids that are not doing much. They try to do their schoolwork, but otherwise they're playing games or staying in bed, and sometimes that is causing them to have more sadness, more deterioration of behavior. So children feel safe when they have structure. So thinking about ways to keep some regular routines, maybe even around just like getting up at a certain time of the day, eating meals at certain times, doing schoolwork at regular times, having some sort of schedule or structure that feels like they know what to expect from their day, throwing in some, playtime, exercise, whatever that might be. This could be hard for some families, and that's why we need to just make sure that we're layering in that flexibility. We're all doing the best we can, and caregivers who are overwhelmed with all of these added stresses of figuring out how to help their kids do their schoolwork or even have access to their schoolwork, maybe making sure that they have the meals prepared and ready to go, and also some still working. These are all challenging things. So just doing the best we can to try to keep some schedule, some routine for our kids who may be really struggling with not having that typical schedule they would have when they're in school every day. So also some children may need to express and actually like feel the feelings they're having. And so helping to provide a safe space so that they can express or just connecting with them can be really helpful. And if that isn't a possibility, connecting them with counselors or some of the support hotlines that are available right now, or even other family members that they can talk to can be really helpful. And just telling our kids that it's okay to talk. It's okay to talk to me about how you feel and I can handle it. And then really just listening to what they have to say can make a really big difference. So, of course, focusing on connection and self-care whenever possible. One way to connect is really just spending time together doing fun things. It can be a nice distraction from everything else going on. You could play a card game or build together with blocks, draw your favorite characters from cartoons, or even just going for a walk together. Also, children can pick up on the emotions and cues of adults around them. So just like when you're putting your oxygen mask on first, caregivers have to take care of themselves first. So taking a break, utilizing your own strategies for self-soothing, whatever that might be. You might be taking a walk, taking slow, deep breaths, calling a friend for support, taking a shower and getting away from everybody for a little bit. Those can be nice breaks just to take care of yourself. And caregivers definitely have their own feelings and concerns right now. So this is so important. We can't really take care of our kids and help them be okay if we're not okay. So I just want to kind of add a little bit about regulation and regulating emotions, because that's usually what's happening when we're seeing this deterioration of behaviors. Understanding that this regulation is how we stay calm when we're overwhelmed with emotions. And we can notice that people aren't regulating very well when they're seeming to have like anger and fear, or they could be really calm. That shows us that they're actually regulating well. And we can also see, like, internally, we know we're feeling dysregulated when our heart's beating faster, or we're breathing really shallow, or our muscles are tensing. And these things are signs that indicate whether or not we're feeling regulated. So if we are regulating, we're soothing ourselves, we're thinking about what we can do to take care of ourselves. And I think that's the important part. We're thinking about it. So as adults, we sometimes have an easier time regulating our emotions than kids do. But even adults sometimes have intense feelings that overwhelm our capacity to cope. And we sometimes need help from others too. So with your children, sometimes they require assistance with this regulation. Just like when babies cry because they have uncomfortable feelings, caregivers soothe them. They pick them up and they hold them and they rock them, or make sure their needs are met, talk to them softly. But similarly, older children and teens often still need help when their emotions overwhelm their capacity to cope. So thinking about what can we do when they are feeling triggered, and they're not taking the moment to take a step back and take a breath and bring down their level of intensity. So in order to do that, they actually have to have a good sense of awareness and the ability to reflect. And a lot of kids and teens just haven't developed that yet. So if you're trying to talk to your child and say, I know you're really upset, but I need you to go and clean up your toys right now, they're in a state that they won't be able to listen. They can't really comprehend what you're saying, and they're having trouble coping. So we have to help them get to a lower level of intensity so that they can hear what you need them to do. So things that you can do to help.
Maybe this is a good, sorry. I was going to say, I think maybe this is a good place to kind of hand off to Barb, because you've been talking about the importance of the adults both taking care of themselves as well as reaching out for help when they need it for their children. And I know that Barb can talk a little bit to some of the resources that are available here in Delaware to support families. So let's hand off to Barb.
Okay, thanks.
Thank you. So I just wanted to go along with what you were just saying, and let families know that they're not alone. So a lot of the concerns that we're experiencing during the COVID-19 pandemic is what we're hearing from our families that we're working with. Their biggest stress or their biggest struggles, we've narrowed it down. There's a lot. So I'm not saying these are only stressors. We understand there's a lot. But the common themes that we've noticed are Teaching your own children at home. It's not something we're used to, even myself. I don't think I was meant to teach my kids, but I'm doing it. So I think that's probably one of the biggest stresses we're hearing from families is trying to figure out how to teach their children. They don't have the training that teachers have. They don't know the material themselves. So to try to learn along with their children is a stressor. Let's see. And then, the families are also stressed about, is my family going to be sick? Are we going to be okay? Do we all need to get tested? Where do we go to get tested? What happens if we come back positive? So we've been talking to them about, well, these are the steps we're going to take. Here's where you can go to get the answers, to get the test done. Again, one of you had said they're stressing about, the meals. They're used to their children going to school. They're having breakfast and lunch at school, so they're used to only having to worry about making dinner at home and buying enough groceries to have dinner at home. So now there's the extra stress. So we're working on, here's where you can get free breakfast or free lunch. Here's how to go about getting them. We're connecting them with food banks, even some clothing closets. Not many of those are open anymore, but we still have those resources available for them. We're connecting them with other resources because families are really working or noticing not only their children's anxiety, but now they're noticing their own. Maybe they didn't even realize they had anxiety before, but now with this cabin fever that everybody has, they're really picking up on everybody in the house having some type of anxiety during the quarantine. Families don't know what to do with their children now. I think I think Malia just said about, the activities, taking a walk, playing a game, building something. So we're trying to load them up with different activities so you're not doing the same thing every day, because we know kids have about that much time to spend on one activity before they want to move on. So we're really trying to load our families up with just different activities that are either free, cheap, or don't require any materials at all, just something to do together as a family, to bring you closer, to start the conversations. We do a lot of conversation starters with our families. But we don't want to take away from the fact that they still need to be working on their family goals and even their personal goals. So we try to bring them back to, okay, we're addressing all of your concerns, but what are you doing for yourself? And are we still working towards your family goals? Yes, the world is different right now. And yes, your focus has to be different right now. But we've set goals as a family. So let's find a way now to still continue to work towards those goals, even though the world has changed, because there's still a way to do it. It's just going to look different now. Of course, working on strategies to achieve their goals. And I think Malia had just talked about taking care of yourself before you can take care of your children. So we're still always stressing the importance of self-care. We're sending out different self-care activities, again, that are free or cheap and that you can do at home, that you don't have to go get your nails done. That's not necessarily considered self-care. You can take a bath. You can take a shower. It's okay to take a shower by yourself. The kids don't have to stand there with you. And sometimes it is as simple as that families think that they have to be with their children 24/7 because they're just not used to it. And we're still encouraging families to continue with their therapy sessions, whether it's family therapy or the individual child's therapy. Everything is pretty much going to telehealth. And I think families they're coming around to it. We're still providing services via telehealth as well. And our families had to learn. Obviously, it's something new. And we're all having to learn together. So they're not sure about it. So some of them have backed off. But we continue to really stress the importance of it, especially during this time. And we just, we talked to them about, we just talked about these are your anxieties. These are the stressors you're seeing within the family. It's really a good time to reach out to your therapist and do your telehealth session and see how they can help you, and see how they can help the family. So those are the most common things that we're noticing during our sessions with families. I hope I can share on the screen. I've put just together a one-pager that everybody had sent me resources earlier. So I wanted to try to share that onto the screen so that you guys could have it. It wasn't just going to be me telling you and then you'd have to try to remember what I said. So you can screenshot it or pause the video at whatever point. I don't know, did that work?
It
It
did.
did. That's great, Barb.
Okay, good.
That's awesome. So if you don't mind, I think what I'll do, because I think we're moving just towards the end of our time, is as you're kind of showing everyone some of these resources, I want to just take a minute and kind of sum up what I heard. So we've talked about the fact that mental health problems in children are extremely common, and that there are a lot of helpful interventions and treatment that can really help children. We talked about the fact that with COVID, a lot of what's happening right now is adding stress that may increase children's mental health problems or actually cause new ones to develop. Malia talked about some of the things to look for around kind of changes in behavior, changes in mood. We talked about the importance of and opportunities to build resilience for children, as well as for all of us as adults to build our own resilience, the importance of caregivers taking care of themselves to be best able to take care of their children, and about a lot of the resources that are out there. Malia mentioned our statewide crisis line for children and their families. Barbara mentioned the things that her organization, Champions, is providing, encouraging people to continue with their treatment services. Most mental health providers are still providing service, although it's through telehealth. So if you're not sure, contact your provider. There are agencies like NAMI Delaware and the Mental Health Association and Jewish Family Services. Many of them are now offering emotional support lines as well. 211 and some other resources can help families. Barb mentioned some of the challenges around kind of basic needs at this point, and some families are really experiencing a lot of stress around making sure there's enough food for their family or concerns about housing. So you can contact 211. Certainly on the Children's Department website, on the Delaware Guidance website, on Champions website, we've all posted resources for families, for themselves and their children as well. So we hope that this information has been helpful to you. Some things kind of recognizing that in this very extraordinary time, we know that many children may be struggling, what to look for, and all of the resources available. And I also think at the end of this talk, you'll also see posted some additional resources. So I think I can speak hopefully for all of us. We just want to wish you all well.
Yeah.
We hope that you're safe. Please reach out. There are a lot of people here in Delaware who want to support families and their children, and we just encourage you to take good care. So thank you very much.
Thank you, everyone.
Thank you.